just fundamentally broken. And we're going to continue our efforts to do everything we can to put the American people back in charge of their own health care and not the federal government.
Well, the wait is over. The ruling is out now. Obamacare is again affirmed as the law of the land, or is it? We just heard Speaker of the House John Boehner there saying he'll try to repeal Obamacare after the Supreme Court left the law intact, those subsidies explicitly. So what happens next? Let's bring in our panel. Joining us right now is the Communications Director for the Republican National Committee, Sean Spicer. Also joining us is Newsmax Deputy Health Editor Nick Tate. He's also the co-author of the Da Vinci's Baby Boomer Survival Guide. Welcome to you both. Nick, let's start with you. We were talking about the ruling earlier today. A little bit surprised that it was 6-3 and not 5-4, right?
Absolutely. I mean, we thought it would be much closer than it actually was. But what it really does is it kicks the ball back to the Republicans in Congress and maybe the Republicans running for president to try to fix the law. It does nothing to address the problems that we've been seeing over the last 4 or 5 years that have rolled out as a result of Obamacare. Well,
Sean, we know constitutionally speaking, it is the job of Congress to come up with some sort of alternative here to replace this. But who do you think has more, we're talking about the media here, we're talking about the public perception. Who is the one who should really take the lead? Should it be these presidential candidates or should it be the leadership in Congress?
That's a great question. I think it's probably a little bit of both. I think you're going to hear some of the presidential candidates talk about what they would do if they were president, their vision forward, and what they would replace Obamacare for. But at the end of the day, right now, we've got a Congress, a Republican House, and a Republican Senate that actually can continue to put alternatives on the table. And I think what they've got to do is figure out what the strategy is. Do they want to keep having repeal votes and make the president veto some of the repeal? Do they want to add in some of the replace elements and some of the alternative things? But I think there's going to be a big talk today. I think going back to what Nick said, I think that people did think there's going to be 5-4 or maybe, either way. And I think there's a lot of head scratching going on right now on Capitol Hill. This was not sort of the outcome that people expected.
Head scratching is one way to describe it. Now, you look at the ruling here, you talk about the response as well, Sean. I was looking at Twitter today, and depends on who you're reading here. Some of the Republican members of the House and the Senate are saying it's time to replace Obamacare. Some are saying it's time to repeal the law. That is an important distinction, is it not, in terms of the GOP strategy moving forward? Is it time to replace or is it time to repeal?
I mean, I think it's got to be a combination. If you're going to, we've made the insurance companies conform to something that the American people don't want, and so the system is now set up to provide health care under Obamacare. I think if we're going to repeal it, we have to have an alternative, and that alternative. And so I don't know that I sort of think of replace, but I think you have to have an alternative. We're going to take away what they have and what the American people clearly don't want. I think we have to make sure that we've got a system ready to go that ensures continuous health care coverage. The bottom line, when you look at what this was really called, the Affordable Care Act, and what the goals were, which is to provide additional health insurance to the people who didn't have it in a lower cost, it's really done neither of those things. And I think Republicans, the goal of Republicans all along, before we had this government takeover of healthcare, was to figure out how do we do both? How do we use market-based solutions to give people more choice in healthcare, to provide a better relationship between doctors and patients, but also that utilize those market forces to get costs down. And I think that was sort of the big joke of Obamacare, that it was ever going to bring costs down.
Well, I think it has a new name now today, right? SCOTUS Care, as Justice Scalia called it. But Nick, as we look at this here, Republicans have talked in the past about tearing the law out by the roots here, but that appears to be a lot more difficult, does it not?
I think it does. But, one of the plans that's out there, Senator Bill Cassidy's plan, senator from Louisiana, would actually substitute many of the aspects of Obamacare with tax credits that would go to individuals through these HSA accounts that would be created in individuals' names, and they could then spend that money on health care or health care premiums. Those states that would go along with that plan would have the ability to adopt it as an alternative to all of the mandates, to the Obamacare exchanges, to the individual mandate, the employer mandate. So it would give states a choice, in many ways accomplishing repeal and replacement at once. The other thing that I really like about it, to Sean's point, is that it would require healthcare providers to produce a kind of price list, a menu of what it costs for a CAT scan or an X-ray or a test. So individuals would be able to make choices based on costs, which in itself, just that transparency, would hold down the costs and actually get us a lot closer to an Affordable Care Act than we're getting with Obamacare. So I think we're going to hear a lot of people talking about that plan. Tom Price in the House has introduced a similar piece of legislation, and it will be interesting to see whether or not the Republican candidates for president get behind those plans or come up with alternatives that will do some of those same things.
Yeah, guys, we're out of time, unfortunately. Well, go ahead, Sean. We have 20 seconds to wrap it up.
I was going to say, Nick's point's exactly the point. Just because Obamacare became sort of upheld today doesn't mean the discussion is over. He's absolutely right. There's a lot more discussions. Republicans aren't going to just say because it was upheld that the discussion is over. We're going to keep fighting
not.
a much better healthcare system.
Certainly not. We know we'll hear a lot more about it very soon, at least on the stump and in the halls of Congress. Sean Spicer, Nick Tate, thanks so much for being with us today. And, of course, you can get the Da Vinci Baby Boomer Survival Guide. To learn more about the book, Nick Tate's book, go to babyboomers711.com. Again, it's great info on how to survive the baby boomer financial crisis, including how to survive Obamacare. We'll be right back after this.